A woman walks into her doctor's office and asks for a physical. No, this isn't the beginning of a bad joke, but it could be how you wind up with a bill of over $400 if you have original Medicare. Now, we get a lot of panicked phone calls from people after they've received some pretty big bills. And unfortunately, sometimes there's just not much you can do about it. But I would urge you to remember that somewhere around 80% of medical bills have some type of error in them, so that's why it's very important that you stay proactive and stay informed. So today I want to talk about physicals. I know, very exciting. Specifically, I want to talk about the terminology that Medicare uses, the minutia, and basically discuss how you can get these types of things covered to help you to avoid some very big bills. Now remember, we are licensed health insurance brokers. That means we work for you. That means we work for the individual, not Medicare and not the health insurance carriers. So if you do have questions about this or anything else Medicare related, you can reach us in the comments below or at the number on the screen. And of course, there is no charge for our services. Original Medicare is divided into two parts. There's Part A, which is your hospital insurance, and Part B, which is your medical insurance. Basically, anytime you see a doctor, Part B is going to be billed. And that's what we're really going to be talking about today, Part B. Now, you think of your regular doctor's visits as anytime you basically see your PCP, which is your primary care physician. Medicare will divide these into three different categories. There is the Welcome to Medicare visit, a Medicare wellness visit, and that routine physical. These are the three basic, quote-unquote, regular types of doctor's visits according to Medicare. There's the Welcome to Medicare visit, the Medicare wellness visit, and routine physical exams. So you're going to see that there is a lot of crossover, and there are a lot of similarities. The differences are rather minute, but what really sets these apart additionally are the timing of them and really the purpose of them. So the first visit is the Welcome to Medicare visit, which is of course your welcome visit. Now this must be completed within the first 12 months of enrolling in Medicare Part B. During this visit, you will review your medical and family history. Your doctor will take some routine measurements such as height, weight, blood pressure. You'll go over your list of doctors and prescription drugs. Your doctor will schedule preventative screenings with you. He or she will look for any signs of impairment, dementia, memory loss, signs of frailty, and you'll go over your health risk assessment, which is basically a questionnaire. Then there is a Medicare wellness visit. This visit is very similar to your Welcome to Medicare visit. However, this one comes down to the timing. So, a Medicare wellness visit is after you've been enrolled in Medicare Part B for at least 12 months. And it cannot be within 11 months of your last Medicare wellness visit, or it won't be covered, because both your Welcome to Medicare visit and your Medicare wellness visits are completely covered by Medicare. Again, you're going to review medical and family history, take those routine measurements, go over your list of doctors, possibly update them. You'll schedule your preventative screenings, you'll do cognitive wellness exams, and your doctor will put together, any type of medical advice that they feel is necessary based on your current health. And then there are physical exams. These are not covered by Medicare. And these are really meant if something's bothering you, something that you might go to the doctor for, if you're sick, if something's bothering you. Again, you'll review medical and family history, routine measurements. They're going to assess your risk factors based on your health. They're going to do a physical exam of your lungs, head, neck, brain, your abdomen, whatever it is that is bothering you. They'll test your reflexes and your vital signs and send out for blood work or urine analysis. And these tests are all going to be billed individually. So this is the type of regular exam, quote unquote, that's not really covered by Medicare. So you will have to pay for some portion of it, and again, all those tests individually. So remember, a physical examination not in relation to the treatment or diagnosis of a specific condition is not covered by Medicare. If your visit falls outside Medicare's parameters, then you may be responsible for the entirety of the bill. Be especially careful if your doctor presents you with any type of liability paperwork, especially if it's the advanced beneficiary notice of non-coverage. Pause this video, rewind it back, and write that down. There's a lot of forms that can be pretty standard, but remember, you are opening yourself up to liability, so please be informed. Now, if it is in fact a diagnostic visit, then you'll likely have to pay towards your Part B deductible and then that 20% Medicare coinsurance. And this applies to any additional medical services or lab work, so you can see how that can add up quite quickly as well. There are things you can do to get it covered, and we're going to talk about that later in the video. Now, Medicare offers many different types of screenings. The list is quite long, and Medicare really does offer very excellent coverage. However, it's imperative that you operate within Medicare's guidelines, because if you do step outside of those guidelines, that's how you wind up with very big bills. And this is what we do, and I'll be honest, it's not always easy to understand. So it's certainly not the time to start delving into the minutia of Medicare and what it covers and what it doesn't when you're already stressed about some type of medical condition. So I certainly hope that you're being proactive and doing your research in advance. That being said, that's another good reason to work with a broker, because a broker, as I said earlier, works for you, the individual, not Medicare, not the doctors, and we often help our clients with disputes about claims and serve as a liaison between the client and the insurance carrier. Anyway, in addition to those big bills that you might get when you're operating outside of Medicare's parameters, sometimes you receive an unexpected bill when something goes from screening to diagnostic. For example, let's talk about colonoscopies. So here's one of those tricky things with Medicare where we go from screening to diagnostic and how that can actually change how much you're going to pay. And I'm just going to gloss over the fact that Medicare only covers colonoscopy once every 120 months. That's 10 years, unless you're considered high risk, at which point it would cover it every 24 months. This is why we always say it's very important that you understand the guidelines, because if you were to go to get tested for a colonoscopy more regularly than once every 10 years and you're not at high risk, you might be on the hook for the full bill. That being said, if you go in for a colonoscopy following Medicare's guidelines as a screening test and your doctor accepts Medicare, then you actually have no copay, no coinsurance, there's no charge. However, if your doctor finds and removes a polyp or other tissue during colonoscopy, you pay 15% of the Medicare approved amount. Plus, if it happens in a hospital, outpatient, or ambulatory surgical center, you also pay the facility a 15% coinsurance. So you went from paying nothing to now paying hundreds and hundreds of dollars. This is again why Medicare supplement plans are so very popular. Now, I know we've talked about some scary stuff so far and big bills, but truly and honestly, Medicare really is excellent coverage. It's just important that you know how to maximize your coverage. And one great way to maximize your benefits is with a Medigap plan, also known as a Medicare supplement plan. These types of plans will fill in the financial gaps of original Medicare. And there are actually more financial gaps than what we've talked about so far. There are 10 different plans to choose from with varying levels of coverage and varying price points. So here are the 10 Medigap plans available. Plan A, B, C, D, F, G, K, L, M, and N. And this chart just details what benefits are offered by which plan. Now remember, Medigap plans aren't going to offer additional benefits that aren't already offered by original Medicare. For example, original Medicare doesn't offer dental benefits, so you're not going to see that any of these plans offer dental benefits. Instead, what they're going to do is help to cover or possibly entirely cover copays, coinsurance, and deductibles. So basically, you pay a little bit extra, but almost all of your out-of-pocket expenses, or possibly all of your out-of-pocket expenses, will be taken care of. So you can see that all of the plans will cover your Part A coinsurance, which is extremely helpful. All the plans will cover in some capacity Part B coinsurance or copays. Plans K and L are known as cost-sharing plans. So basically, they're going to contribute to these out-of-pocket costs, but Plan K will cover 50% of your cost, and Plan L will cover 75%, and that's just pretty much, generally speaking, across the board. All the plans will cover the first 3 pints of blood in case of need of transfusion. Part A, hospice care, coinsurance or copays, that's very important. Skilled nursing facility care coinsurance, again, very, very important. The only plans that don't offer that is Plan A and Plan B. Your Part A deductible, that's that deductible that's applied per benefit period. So if you do need to be hospitalized more than once in a given year, then you might have to meet that deductible again, and that can certainly be very expensive. The Part B deductible, no plans that are offered to new enrollees are going to cover that Part B deductible, but that's a once annual deductible and it's not very expensive, so it's not your biggest concern. Part B excess charges. So basically, if your doctor accepts original Medicare, then they accept the amount that Medicare is willing to pay out. However, they can choose to charge an excess charge, which is up to 15% more. Now, I wouldn't necessarily worry about these because they're not all that common and they're not even permissible in all states. The only plans that do cover Part B excess charges are plans F and G. Plan F is one of those plans that's not offered to new enrollees, but if you are looking for the most comprehensive coverage available to everyone, then that would be Plan G. Foreign travel, almost all plans will cover that in some capacity, 80%. And then there's just out-of-pocket limit. You'll see it's asterisked here because it's not really applicable. For example, Plan F and Plan G, and even to an extent Plan N, are really going to cover all of your out-of-pocket expenses except for possibly that Part B deductible. Plans K and Plan L, because they are the cost-sharing plans, they do have an out-of-pocket maximum, which is very helpful because if you do have major medical bills, original Medicare doesn't have any type of limit or threshold on what your spending could be. So what is the best Medicare supplement plan? Well, I'll let you in on a not-so-secret secret. Most brokers and most of our clients would agree that Plan G is the best plan available, and it's certainly the most comprehensive coverage available to new beneficiaries. Now, when you run the numbers, Plan G often winds up on top. That being said, it's very important if you are going to enroll in a Medigap plan to do so in the 6-month window after you turn 65 and enroll in Part B. During this time, you will not be subject to medical underwriting, which means you can't be charged more or denied based on your health. And this is so important. Very often when people first enroll in Medicare, their medical needs are not extremely extensive, so they want to put off enrolling in a Medicare supplement plan, which is completely understandable, or perhaps they enroll in one of the less expensive plans. And then as they get a little older and their medical needs become more extensive, when they want to enroll in a Medigap plan or switch to a more comprehensive plan, at that point it can be too late. So if you do want to learn more about Medicare supplement plans and why most of our clients still prefer Plan G, make sure to check out this video over here. Also, don't forget to like and subscribe and reach out in the comments or at the phone number on the screen with any questions. We'll see you next time.